So, how these are the effects, how these drugs are acting, that we have seen. Then next is all beta blockers, they are masked, means they will not allow the signs of hypoglycemic problems in diabetic patient, and therefore this patient can go in coma very easily. So, it should be used very carefully in these conditions. Okay. So, these are the beta blocker effects. Sympathetic stimulation is there to heart, beta 1 receptors, through beta 1 it causes these effects. Myocardial contractility increases, heart rate, cardiac output, cardiac work increases, oxygen consumption increases. If we block this, then all these things decreases. Because of this, whatsoever effect we are going to see, whether in hypertension, arrhythmia, and angina, etc., thus it will be helpful. So, these are the, it will be slowing the SA node, they will be decreasing the conductivity from SA to AV node, AV to Purkinje fiber and all. Then there can be dilation of arteries, and it causes effects on various aspects of the heart. So, these are the effects which we have seen. What are the blocker they will do with the beta blocker? If it is having action on beta 2, then it can cause increase in the peripheral resistance, because beta 2 is vasodilatory in nature, and because of that it can cause increase in the blood flow to organs, and because of that they are contraindicated in the peripheral diseases like Raynaud disease. Now mind well, this is important in what circumstances? For the drugs which are having particularly more beta 2 mediated effect, or the selectivity is less, example propranolol, etc. But if they are only beta 1, then this kind of effects you will not able to see. So, this is how the logic works, or this is how the what we can say application of knowledge works, or common sense work. So, the effects are there on beta 2. Now, beta 2 selectivity, wherever it is comparatively more beta 1 selective. So, in that cases this kind of effects will be very, very less visible. So, these drugs will not be contraindicated in this also. Okay. So, this is very important. But if it is the older drug, or first drug which was there, beta propranolol, when it was used, so it will be causing both activities. So, blood pressure, antihypertensive activities will be there, they will be decreasing the blood pressure in the hypertensive patients. Due to effects on decrease in the cardiac output, because of that renin-angiotensin mechanism, and also presynaptic inhibition of noradrenaline release from the adrenergic nerve. These are three major effects it is showing, and this we have seen at 3 times actually. We have seen the autoreceptor mediated effect when we studied ANS, and during hypertension when we classified beta blocker, at that time also we have seen all these 3 mechanisms, and initially also we have seen renin-angiotensin and all. So, these are 3 important mechanisms which we have repeated. These are through which these drugs are acting. So, already we have studied this renin-angiotensin, how this is converted, how angiotensin 2 is released, and how it causes vasoconstriction because of the AT1 receptor, and how it causes release of aldosterone, and because of aldosterone sodium potassium activities are changing. So, these are all effects we have seen by different mechanism, by a different kind of chart, and this is how these effects are there. Only thing is, you should remember, you should understand how it is there. Okay. So, since it the adrenergic beta 1 receptors are responsible for renin release, when we block it with the beta 1 receptor, it will cause decrease in the renin synthesis. If renin is less, then it will not be converted into angiotensin 1. Just a minute. Hello, ji sir. हाँ सर.